I am very excited to be here today to meet with Dr. Michael Genord, who is the CEO of Health Alliance Plan HAP. I'm going to call him Mike, though, for the rest of this, just so we know. But Mike, thank you so much for joining us today.
It's so great to be here. Thanks for having us.
For sure. Well, first, I'd like to start off with, could you just tell us a little bit about how you got here? I mean, obviously, we'd love to hear from CEOs in the area, but you have a very interesting path.
Yeah, for 20 years I had the pleasure of taking care of women and delivering babies and bringing life into the world, but it was changing women's life one life at a time, and I had a greater calling of how do you increase your voice in a health economy, add value, work towards social determinants health, health equity, and it led me on a very interesting path, bringing me to the payer side of health insurance in Flint, Michigan at Health Plus, and then I came to Henry Ford Health as well as Health Alliance Plan 6 years ago.
Well, and I could see how there would be a huge value in having a doctor take over as CEO for an insurance company, because we see how important this is, but why do you think that's such a strong component of having you here?
One of the things when I was a private physician, I was responding to things that the insurance companies were doing to really try to improve quality and affordability. But some of it was misguided, and it was because their lack of actually seeing patients and going from room to room or getting up in the middle of the night and delivering a baby.
There's a disconnect.
There's a disconnect.
Yeah.
And so I'm excited that I can bring my business acumen to real life taking care of patients. So we at Health Alliance Plan here really make sure everything we put the member and the providers in the forefront to deliver on that value of increasing quality, better consumer experience, affordability, all those things that we as a country are struggling with in the healthcare industry.
Well, and you talk about social determinants of health. Obviously, we see this as very important. So how is Health Alliance Plan working with that and making sure we're ensuring?
So it's great. I think that, some of the challenges as healthcare is these runaway costs, and how do we bring those in? And the reality of it is our genetics and physical illnesses only count about 20 to 30% of our health outcomes. It's the zip codes we live in, the diets we consume, the activity, the violent education that we're wrapped around in our community. So Health Alliance Plan, you will see us all over, whether it's the Flint Farmers Market or giving coats to the Detroit schools, washing machines, helping those kids be successful in school by taking some of the burdens of their everyday struggles away so they can focus. So we work every day understanding that if we can bring a little solution to those problems, it has huge benefits on the sense of well-being, health, and the quality of their life.
Well, it's so important that you bring that up, because I think one of the things that people don't understand is some of these are environmental aspects, access to care. Some of these things don't occur just based on a standard, I'm sick today, I have a cold or a headache. That's not the case. You're having a proactive approach towards healthcare and moving things forward.
Extremely important to point that out. And Health Alliance Plan is part of the Henry Ford Health team. Mm-hmm. Henry Ford Health has been in the city for over 100 years. Race riots, poverty, bankruptcy, and they've been working along with HAP how to solve these very difficult problems. And we have a very robust diversity, equity, inclusion, and justice program. And it's not to say it, it's because we believe that it leads to someone's well-being. Yeah. And that translates into higher quality, lower costs for the consumers of Troy and all those people that are paying these bills to help keep their employees healthy. Yeah. We want to bring solutions to them. We want to partner with them in a way that's meaningful.
Well, I'd like to also talk about the fact that obviously being local is very important. So as you're talking to people, what is the importance of making sure that they're looking at their insurance plans local, making sure there's a local connection to it? Can you talk me through that?
Yeah, so first, we're a nonprofit company, so we commit back to the communities.
Which a lot of people don't know that, and
exactly
that's a good
right.
thing to point out.
A lot of these national health plans that are in all of our 401ks give money back to equity, to Wall Street. We really commit to the community. But most importantly, our employees live and work in the communities that we're practicing in. So when you call and talk to a care manager or a nurse at HAP, they could be your neighbor. When you're talking to a doctor who's going through your care management and helping you navigate that, that's a physician that practiced in this community. And we believe that's an extremely important difference with organizations like Henry Ford Health and Health Alliance Plan.
So with that being said, how do Michigan employers reach out to you guys? How can they get things started, get things moving?
Yeah, so we have a very rich producer channel of people that are out there representing companies with HR people to buy insurance for their employees, certainly reaching out to them. But we have an internal team where we go out and actually meet with employers. We look at their employer use, how many of their employees are in ERs or using opiate medications or have chronic illnesses, and how can we partner differently to get farther up in their healthcare journey to make it more affordable and lead to higher quality.
I have to smile because when you were saying that, I kind of lit up in that moment, because the thing is that you make it personal.
Yes.
And I think every situation has to be personal. And as you're working with these employers, I'd love that you're like, we're going to meet with you.
Yeah.
We're going to sit down with you and see what's the right thing to do. And that's sometimes people don't look at healthcare that way. And that's really inspiring just to hear in itself.
It's incredible. We have something called the Member 360, and we try to learn everything we can about our member. So if you're an Hispanic person in a Hispanic community in a zip code, we need to have solutions for you that make sense. Dietary things that make sense. If you live in northern Oakland County, that may be a different solution. So you're exactly right. Being local and actually understanding that not you're just a diabetic, a woman, but you're a diabetic woman and you're also dealing with all these other things in your local environment, and how can HAP and Henry Ford help you with those things?
Well, and as you mentioned that, sometimes it's going to be access to things. So if we're saying, hey, you're a diabetic, but maybe you don't have a grocery store near you.
Absolutely.
These are some of those needs, and understanding, hey, with looking at maybe there's really poor street lighting. Are they having access and the ability to go for a walk and get those kind of everyday health activities that gives you that proactive approach?
And that's why health is local.
Yes.
Henry Ford and HAP commit to the neighborhoods we're in. When you look at housing support we give, Meals on Wheels, Mom's Meals, all of these things are local. They're meant to develop and solve local problems, not from New York or some other national firm, but rather
phone call
right
you
here.
can't get through, right?
Yes, exactly, exactly. We never want to have a phone call you can't get through at HAP.
You don't want to be on pause for that long, so that's
Absolutely.
a good. Okay, let's get to the fun question. That's called cost. We consistently hear of people saying they can't afford healthcare, they can't afford insurance. What are some of the trends we're seeing to help aid in this, I guess, aspect in these conversations?
Yeah, affordability is so important. People cannot choose between food and their drugs or a copay or a high deductible plan. So we talk all about incentive and alignment. We really want to partner, and me as a physician leading a health plan, partnering with physicians to get farther upstream. What are the social service things, the benefits that we need to bring outside a physician office to help a physician be successful in getting their patients farther up in the healthcare journey to drive well-being? And I'm not only talking physical, behavioral health, dealing with depression, anxiety, and things that can prevent people from taking their diabetic medication. So it really is about alignment and incentivizing that dollar that people are paying to get the highest value out of.
Talk me through some of the incentivizing pieces. Like, what does that look like?
So one of the things is we work with physicians and really bring them into the discussion about, here's the dollar, how do we want to spend it together? And as we are successful in creating health, we get to keep some of that dollar to further fund things in social determinants and health.
Ugh, love it.
And align their ability to have a happy, successful profession.
Mm-hmm. And we look at health as the well-being of all. And I think that's what's so inspiring about what you guys are doing. So I do have a few final questions, but one question just out of curiosity. Mm-hmm. So do you miss delivering babies?
There's something intimate about being able to be in someone's life during childbirth or gynecological problems or the unfortunate things of breast cancer diagnosis that I could really partner with them very personally on their journey. And I certainly do miss that, but then I go back of, the work we're doing here at HAP is really trying to not change one woman's life, but to create solutions for all of the women seeking health care and making their life. So there's certainly times when I walk through a hospital, there's that little ping in my heart, like I'm not in the throe of the OR or the delivery room. But I'm grounded in what the missions that we're doing here and lay down every night being really blessed to be able to do this.
Well, it's about the impact you can make. And while I'm sure you made wonderful impacts throughout your career, knowing that you have this big picture ahead of you and you can just change the health of a giant community like Metro Detroit, it's a really great thing. So I really appreciate that.
Thank you.
Is there any other things you'd like to share, any fun little nuggets with us before we wrap up?
No, I just loved, that you're highlighting what we're doing. The importance of the health of our communities drives so much for our employers, that their employers show up to work and be able to have fruitful and meaningful lives. And this is a really important dialogue.
Thank you, Mike, so much for joining us today. Obviously, we're completely inspired by the great things you are doing here and everyone at Health Alliance Plan HAP. I always have to say the whole thing.
Absolutely.
I kind of like it that way. It gives me like the old character and then I move into the new trend. So we're very grateful to have you guys as Platinum members of the Troy Chamber. And I do hope all of our listeners today did actually learn a little bit and maybe are inspired about getting some great healthcare insurance. So
thanks for having me.
Well, thank you guys so much. Again, I'd like to thank our presenting sponsor, Trion Solutions. Please stay tuned to see their little commercial break at the end. And you guys, thank you so much for joining us at Inside Corporate Troy. We'll see you next time.
My name is Jenny Brown. I am the CEO of Dutton Farm. We are a nonprofit in the behavioral health system. In the nonprofit sector, we are all focused on keeping our costs down while also maintaining the quality of services that we deliver. And a great way to do that is to partner with Trion Solutions so they can come alongside of you for those HR functions and make sure you are operating with excellence in that area.
And that's why we rely on Trion.
You can always rely on Trion.